Africa has faced its share of disease outbreaks that have had devastating consequences on the continent. From Ebola to COVID-19, these outbreaks have resulted in numerous deaths. The World Health Organization recorded over 11,000 deaths from Ebola between 2014 and 2016 in West Africa, primarily in Guinea, Liberia, and Sierra Leone. The COVID-19 pandemic, which started in 2020, has recorded over 223,000 deaths in Africa as of December 2022, according to the World Health Organization. This health crisis also caused economic slowdown, and according to the World Bank, the COVID-19 pandemic alone pushed nearly 40 million Africans into extreme poverty. So, what can Africa do differently to mitigate the impact of the next health crisis? In this podcast episode of Africa Science Focus, African researchers Ngamba and Professor Lorena Carrasco offer expert analysis. Jean emphasized the need for African governments to prioritize healthcare investments. This can be done by increasing budgets for healthcare and creating emergency funds for health crises. African governments should not solely rely on external funding. He also highlighted the importance of strengthening the capacity development of healthcare professionals and community health workers because they are closest to the people. Professor Lorena Carrasco conducted research on death and mourning during COVID-19 in South Africa. She recommends that governments and healthcare workers collaborate with communities to dispel fear and prevent the marginalization of individuals who have contracted the disease. She also advises governments to pay attention to research on previous pandemics so they can inform emergency response policies in the future. What role can technology play in assisting health professionals during health emergencies? Tune into the rest of the podcast to find out and also catch up on the latest science and development stories across sub-Saharan Africa.